There are also 3 slide decks that you're going to have to look at independently for Module 2, this first one being infant nutrition. There's a second one on addiction, and then there is one on loss, which we've talked about a little bit in Module 1. For infant nutrition, what you need to concentrate on is the benefits of breastfeeding to both mom and to baby. You want to concentrate on birth control methods that you can educate and advocate for a breastfeeding mother. You want to know what is a normal infant weight loss for breastfeeding and formula feeding. And you want to know a little bit about the physiology of the breast and lactation, just so it helps you to understand what's happening with milk production and milk letdown. Again, benefits of breastfeeding to both mom and baby, normal weight loss in an infant, issues with breastfeeding, signs of, engorgement or mastitis, which we've talked about a little bit in postpartum complications, benefits to the family, again, nutritional needs for the mother, and then any kind of education on hormonal or non-hormonal or barrier contraceptive methods for the mom. What you're going to need to take from the addiction PowerPoint and also the addiction or the chapter in ATI about neonatal substance withdrawal or neonatal opioid withdrawal, which it's called now. So neonatal opioid withdrawal syndrome, NOWS. We used to call it neonatal abstinence syndrome or NAS. You'll hear both terms. You want to recognize the risks that opioids and other illicit substances can pose to infants and how your assessment of those infants are going to be different. So we used to use a neonatal scoring system called the modified Finnegan scoring, and we would give babies a number, and that would give us an idea of whether or not they needed to be treated during their withdrawal. Now, most of the hospitals in Delaware are using the Eat, Sleep, and Console method. So you are looking at outside things that can, make a difference on the outside. So if mom were a smoker, or if mom, drank a lot of caffeine, all of those things kind of factor into what a baby that was also exposed to opioids looks like. But basically with the Eat, Sleep, and Console method, it's can the baby eat, can the baby, suck, can the baby use a bottle, can the baby breastfeed, can the baby stay asleep for any amount of time, and can they console themselves. So this is a new method that you'll see in clinical. This modified Finnegan scoring is an old way that we would see how infants were doing. But what you need to know for this class is the difference between an assessment of an infant that has been exposed to opioids compared to an assessment of an infant that hasn't been exposed to opioids. So a lot of times infants will be hyperactive. They'll have, extremely high respiratory rate. They'll have issues with gastrointestinal disturbances. They'll have central nervous system issues. So you can still use this modifying scoring sheet to look at those things. Most of everything is heightened. So high respirations, high heart rate, sweating, diarrhea, so that it sort of goes into different sections. So central nervous system disturbances, metabolic or vasomotor disturbances, and then gastrointestinal disturbances. So what you really want to know when you're looking at the book or when you're looking at the ATI chapter is how will the assessment of a typical newborn compare to an assessment of a newborn that has been exposed to opioids. And again, everything is heightened in a baby that's withdrawing. So higher respiratory rates, less sleeping, issues with feeding, issues with that suck reflex, that swallowing reflex. Sometimes they'll have fevers, nasal flaring, again, respiratory, issues, respiratory rates very high, projectile vomiting, anything is just sort of heightened. So, and again, it's sort of in 3 different parts. So central nervous system disturbances, vasomotor or metabolic disturbances, and then gastrointestinal disturbances. So those are the things that you want to take away from this addiction PowerPoint. And then for the loss PowerPoint, what you want to take away is early pregnancy loss and late pregnancy loss, just the difference between the two. What you want to concentrate on in your nursing care is therapeutic communication, how you're going to speak to a mom that's experiencing a loss, what you're going to offer her. in the hospital, lots of times they'll have a special room or a special place where women can go for a loss. They'll notify everyone that works in the hospital just by having something on the outside of the door. Many times they'll try to move a mom that's had a loss or that's had a stillbirth so she doesn't actually have to be on the labor and delivery floor. So what you want to concentrate on when you're looking through this PowerPoint is, risk factors of early and late loss and treatment of early and late loss, and then again concentrating on how you're going to communicate to those women, what you can offer them, that holistic nursing care. You want to allow them to hold and bathe and dress the infant. You want to provide support. You want to basically just advocate for however they need to deal with their loss, and you want to offer them information, advocacy, information on support groups, and then again just that therapeutic communication.